number at only 4, we do not believe that we should in any way restrain our efforts to both mitigate this, but also to identify and to manage any patients.
Make sure you contact your provider early if you have been exposed to any infected persons.
And I think there's even been some mention of using less cash. We provide that alternative for individuals.
Growing concerns of a surge in local COVID cases, hotels fold under the impact and NHI's role in assisting those affected. Good morning, everyone. I'm Akush Lapinder, and welcome to the morning edition. Well, despite reports to the contrary, health officials yesterday confirmed that there are no new cases of COVID-19, the fast-moving illness sweeping the globe with some 10,000 deaths worldwide. Health officials now assuring that they stand ready for any possible surge locally. Desmond Saunders has the story.
I think it's critical for us to understand we are at war. There's no doubt about it that as a country, we are fighting a very serious threat that we do not intend to lose.
While there are no new cases of the coronavirus in the Bahamas, Minister of Health, the Honorable Dr. Dwayne Sand, says his team remains resolute in their efforts in combating the deadly virus. He cautioned residents not to have a false sense of security.
We are concerned about the possibility of a surge in the near future. And so while we are gratified to see the number at only 4, we do not believe that we should in any way restrain our efforts to both mitigate this, but also to identify and to manage any patients. And so we are going to ask people not to have a false sense of security.
Some 117 persons have been tested. Currently, there are 4 cases of the coronavirus in the country. The Ministry of Health also revealing that some 1,750 test kits are in New Providence. 10,000 rapid test kits have been ordered. Some 2,500 test kits are expected to be in New Providence by midweek. Further, the minister pointed out that healthcare workers will be well equipped to handle this crisis.
Several weeks ago, we started to identify N95 masks, surgical masks, gloves, gowns, etc. And so we now have more than an adequate supply, not just for healthcare workers, but for immigration, defense force, police officers, and so on and so forth.
Residents can also expect enhanced border control and quarantine measures.
The Bahamas was one of the first countries to implement border control and quarantine initiatives. Many countries around the world followed the lead of the Bahamas. We have assessed the impact of the restrictions that we have made to date, and we continue to adjust them based on our understanding of the situation on the ground.
Ministry of Health also increasing its capacity for testing. Doctors Hospital facility on Blake Road will be used to treat ill COVID-19 positive patients. The Minister of Health advising residents to reject and avoid false news sources on the COVID-19 virus. And he believes the success of this pandemic depends on all Bahamians. Desmond Saunders, ZNS Network News.
Now, as for when the remainder of those test kits will arrive in the Bahamas, the health minister making it clear that they have been ordered from different suppliers.
I have been in touch with the suppliers. Some will arrive, we believe, by Wednesday, some by Thursday, some by Friday. This is a priority item. The Department of Customs, the Control of Customs, has made it clear that there will be no impediment to getting these things into the country.
Meantime, the National Insurance Board clearing the air over unemployment benefits and the current unemployment assistance. That assistance primarily for those who work in the tourism sector and impacted by COVID-19. Chief Manager in the Director's Office, Pandora Butler, says those payments begin this Thursday.
Though this assistance will be managed and paid out for the government of the Bahamas by the National Insurance Board, NIB, the payments do not fall under the umbrella of the National Insurance Program and, as such, will not be subject to any national insurance contribution conditions, nor will they require any Department of Labor involvement. The payment will be $200 per week for up to 8 weeks. We anticipate paying every 2 weeks. Of course, persons claiming the assistance must prove that they are indeed self-employed in the tourism sector. They will do so by completing the form that has been created specially for this purpose. On that form, we will also ask for banking information so that we can deposit payments directly into bank accounts.
Butler also explains the unemployment benefit requirements by NIB, noting they have not changed.
They apply whether you've been laid off, that is, separated from your employer temporarily, or if you've been terminated, made redundant, or you've quit, that is, you are separated from your employer permanently. Income replacement for loss of employment and loss of income due to the closure of the workplace, the downsizing of the workplace, the falling out between you and your workplace, or, as is the case now, the downturn in the economy due to COVID-19 has always been included in the National Insurance unemployment provisions. If you meet the contribution conditions and if you satisfy the Department of Labor's conditions for employment in the country, you are entitled to unemployment benefit.
In related news, a major resort to close in the next 2 days, a move affecting hundreds of its employees. Bahamas Senior Vice President of Governmental and External Affairs Robert Sands says the Cable Beach property will shut its doors on Wednesday, and that's until further notice. Sands says there will be a temporary layoff of all non-essential staff. Well, in a letter to employees, Bahama President Graham Davis assured that as of March 26, the company's full-time associates will receive the equivalent of 40% of their base pay for up to 90 days. Further, the resort will continue to pay the insurance premiums necessary to maintain their employees' health insurance coverage. Sandals and Beaches are following suit with the closure of its properties throughout the Caribbean, and that until May 15th. This due to the recent travel restrictions, no doubt brought about as a result of the ongoing global COVID-19 pandemic. Sandals operates 2 properties here in the Bahamas. Coming up in the morning edition, how you stand to benefit under the National Health Insurance Plan in the COVID-19 climate.
ZNS is everywhere you are when you download the new ZNS app. Watch our live channel to keep up with what's going on in the nation. News updates, we've got you covered. Tune into our radio stations with just a swipe. On the road, on the go, we're here with you. Available for download on the App Store and the Google Play Store.
Hepatitis is the inflammation of the liver, which is the organ responsible for filtering toxins from the body, producing bile for digestion, and producing proteins and clotting factors. The most important cause of hepatitis worldwide is viruses, of which there are 5 main types: A, B, C, D, and E. Hepatitis B and C are major health challenges globally, affecting over 300 million persons worldwide. The suspicion of hepatitis may be a challenge as there are typically no symptoms. However, if infected, non-specific symptoms may include decreased appetite, nausea, vague abdominal discomfort, jaundice or yellow eyes, and abnormal liver function tests. If not treated, hepatitis of any type can lead to cirrhosis and liver cancer, which leads to over 1 million deaths worldwide. If you suspect you may have been exposed to the virus that causes hepatitis, talk to your doctor today and get tested.
This public service announcement is brought to you by the Public Hospitals Authority in conjunction with the Medical Association of the Bahamas and the Broadcasting Corporation of the Bahamas.
Roy's Gallery, number 3 Safri Square, Bay Street, Nassau, Bahamas.
The natural resources of the Bahamas play a critical role in supporting Bahamian livelihoods. For example, the fishing and tourism industry, which include fishermen, seafood exporters, hoteliers, dive operators, restaurants, and others. Collectively, they generate approximately $1.5 billion a year. Therefore, we must respect and preserve what we have. These resources belong to us.
This is my livelihood.
This is my livelihood.
This is my livelihood.
So let's all do our part to maintain our local economy and a good quality of life. Remember, if we take care of nature, nature will take care of us.
Well, like those entities and companies across the country, National Health Insurance is also in COVID-19 mode. NHI has launched its telehealth initiative. In studio with us this morning is CEO of the National Health Insurance Authority, Graham Whitmarsh. Mr. Whitmarsh, welcome to the morning edition.
Thank you.
Share with us how those who have signed up to the plan, NHI plan, can benefit at this time, the new norm as we call it.
For sure. So today NHI has around 80,000 beneficiaries enrolled. We have, since last year, been implementing an electronic health record. We currently have 16 of our clinics are using that record, which means about 30,000 of our beneficiaries have access to the electronic health record, and all of those now will have access to use telehealth. This will mean that those individuals can receive routine care by telehealth. They'll also be able to be pre-screened if they have any symptoms that may be like COVID-19. And so that will be available now to roughly 1/3 of our beneficiaries, and we're looking to expand that rapidly over the coming weeks.
Now, I understand that we're actually ahead in terms of the electronic health records. Tell us more about that.
Well, we made a decision early on, after I arrived 2 years ago, that we would put in place some of the technology that we would expect in modern healthcare. And we provide primary healthcare to individuals. When they sign up with NHI, they get a family doctor. They're able to see that family doctor as many times as they need without copay or deductible. But technology is really important in managing that care to make sure that we get value. Obviously, we didn't see COVID-19 coming at the time that we did that. So over the past year and a half, we've been through the process of procuring and implementing it. It's been a successful process. The first clinics went live last November, and we were planning to roll telehealth out during the course of 2019, but we accelerated that rapidly once the pandemic was declared, and we were ready to go. And in just a few days, we managed to open up 12 of the 16 clinics. The remaining 4 will happen this week, and then we'll look at how we can expand it out to other healthcare providers that are in the NHI network. We today have 91 doctors in 61 facilities providing care.
Well, now that this plan will help control the appointments and the traffic movement at the various clinics, how critical is it to preventing COVID-19?
Well, it's going to do a number of things. I mean, first, people can obviously receive routine care that doesn't require intervention by telehealth. That's much more convenient for them. They can do it at home using a smartphone, an iPad, or on a PC or computer. But it will also allow them now to be screened for symptoms before they go to a clinic or to accident emergency. And that is the advice, that if you do have the symptoms of COVID-19, so fever, cough, tiredness, that you should actually call ahead and not go in. Now with telehealth, they'll be able to be pre-screened. And this really has 2 important effects. This means that healthcare providers that are going to be critical in our response to this are not going to be unnecessarily exposed to the disease. And it also means that those individuals won't be clogging up the waiting rooms or accident emergency, allowing healthcare providers to focus on those individuals who really need that care.
Any other advice you'd give to those who require assistance at this time, as opposed to, flooding NHI or flooding their healthcare facilities?
Well, I think it's really important to understand that most people have mild to moderate symptoms that don't require care and don't require hospitalization. And the advice is don't just go to your clinic or go to accident emergency, but call ahead. And telehealth is a mechanism by which you can get that first line of treatment. You can talk to your provider, you can get advice, and then you should follow the advice that you get from them. It's also possible for you to call the Ministry of Health Surveillance Unit and speak to them, and they'll give you advice. But it's really important that we follow the advice of healthcare professionals at this time.
I know the world is consumed by COVID-19, but what's next for NHI coming out of this pandemic?
Well, we now recognize the power of telehealth that's enabled by the technology that we've implemented. And so we're now looking at a program to accelerate the implementation of the electronic health record. That's a little tricky because we've been relying on help from our supplier that's US-based, and their personnel are no longer in the Bahamas. But we had already trained 2 local specialists in the electronic health record. I think they're the only 2 trained in the Bahamas. So we will be able to proceed. It'll be a little slower than before, but we are also looking at modifying how we implement it so that we can actually slim it down, make it easier for healthcare providers, and see if we can play a bigger role in making sure that we manage the burden on the health system if this situation gets worse.
Well, again, we were speaking with Mr. Graham Whitmarsh. Mr. Whitmarsh, thank you so much for joining us here on the Morning Edition. Well, COVID-19 could impact the lives of those living with compromised immune systems. However, a local rheumatologist is advising persons in this category to be extra careful and to practice social distancing. More from LaDawn Davis.
Make sure you contact your provider early if you have been exposed to any infected persons or you think you have symptoms which have been fever, shortness of breath, or cough. Avoiding crowds, avoiding being out in anywhere that's non-essential for long periods of time, and avoiding congregating with family or friends that are more than 2 at a time.
Now, when asked if persons on existing medications should remain on them, Dr. Roll said this.
I definitely think that patients should stay on their medications, but ultimately the final decision is to be discussed with your primary care provider or your specialist provider. The reason why this is important is, at least for myself, many of my patients are on immunosuppressant drugs. In particular, one is Plaquenil or hydroxychloroquine, and its counterpart is chloroquine itself. And there has been recent studies, one coming from China, preliminary results showing that chloroquine has been useful or showed some efficacy in treating pneumonia associated with COVID-19.
Meanwhile, Dr. Roll says the medical facility has beefed up its efforts to mitigate the risk and the spread of the coronavirus.
We have set up sanitization stations, hand washing stations, where patients can, by the time they come into the door, they can actually wash their hands or use alcohol. We are allowing patients to come in, only no more than 10 patients in the waiting room, because we have a social distancing space between 5 to 6 feet. 2, all persons that are displaying the symptoms that I had mentioned before, like fever, cough, and shortness of breath, we are asking those patients to stay at home, but give us a call so that we can direct you on what you can do further.
Well, the study is still out on the exact impact COVID-19 can have on children. That's the focus of our next guest. Here's Lloyd Allen.
Well, thanks a lot, Makushla. With us in family medicine specialists at the Princess Margaret Hospital, Dr. Estelle Laville. Dr. Laville, she is a consultant specializing in family medicine with the Princess Margaret Hospital and Public Hospitals Authority, also an associate lecturer at the University of the West Indies School of Clinical Medicine and Research. Dr. Laville, today marks 83 days since the world has learned about COVID-19, 349,164 recorded deaths. Out of that, minimal effects in some regards to children, as a majority of cases being with adults. Now, according to the Center for Disease Control in the United States, children are not at higher risk based on available evidence, and children do not appear to be at higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases to date. However, on March 17th, the New York Times reported in an article a study of more than 2,000 children with the virus, and China found that babies were especially vulnerable to developing severe infection. Today, talk to us about the number of children in the country and what are some of the common risk factors for infection specific to children.
Okay, thank you. Well, with children, we feel that they are less likely to have severe infection of COVID-19. However, they are likely to be asymptomatic carriers. So we would really like to reduce the risk to children by continuing the hand washing, the contact exposure, and the making sure that they are limited to their households.
Well, even as schools have been temporarily closed until April 14, what do parents need to know regarding day-to-day protection in the home?
Okay, so please, it is important to wipe down the surfaces at home. It is important to encourage your children to wash their hands for 30 seconds at a time. Remember to supervise them washing the palms, between the fingers, the backs of the hands, and the nails. It is important also to avoid play dates, as every other person that they come into contact with brings with them a risk of infection.
And just hinging on that idea of play dates again, here in the Bahamas, there are informal play dates as well. Kids go outside and connect with their friends. And so talk to us about how that can really create the environment for the spread of COVID-19.
Okay, so the self-isolation procedures in place now speaks to trying to keep households together and at home. So we don't want the children to play with the neighbor's children or with anybody else's children, because that is how we limit the contacts the children have. Okay, so when you send your children out into the yard or to the neighborhood's play group, then they are in contact with everybody that child has been in contact with. So that just increases the number of possible contacts for COVID-19 that we have. So try to keep your children at home or in your personal yard and avoid contact with other children.
Now, we've heard some positive updates globally regarding possible drugs which could eventually be used to treat persons with severe effects of COVID-19, including a drug combo already used against HIV, treatment first tested during World War II, and a new antiviral whose promise against Ebola fizzed last year. Could any of these drugs hold the key to saving COVID-19 patients from serious harm or death, particularly children?
We are very hopeful. However, the trials are very early now, so we're hoping to get some news from that within the next few weeks, or whether we have any success with the chloroquine, the hydrochloroquine, and the ritonavir.
Now, beyond these extra precautions, boosting immunity with more vitamins, fruits, vegetables, social distancing, what more can we do to protect the little ones? Okay,
so there is multifold. Physically, from the COVID itself, continue to wash the hands, continue to avoid contact with other persons. Remember to keep areas safe at home. They're going to need regular snacks since they're at home. They're going to need to continue their studies, and they're also going to need to have one-on-one contact with the parents and other members of the family to make sure that they're well balanced.
Now, over the weekend, of course, we know that several families were out and about to various beaches. Any concerns there?
Okay, I don't have a problem with going to the beach or to the playground, but the thing is we need to keep them away from other children. So if there's a crowd at the playground, then I would stay away from the crowd.
And finally, the psychological impact, an important element to all. First Dorian, then school closures, the threat of COVID, contracting a deadly virus. How do we maintain balance among children?
Okay, I think it's important for us, the adults, to set an example. So I think at this time, if we limit the exposure to the media and social media to the reputable sites, try to switch off the news occasionally so that you can have some one-on-one interaction with your child. Try to play games in terms of board games or other games at home to keep the children occupied and safe, and show them that the family is still a strong unit that gives them a basis for which to thrive.
Excellent information there. Any final words?
Yes, please remember also when you're letting persons into your home, try to have them wash their hands. Try to avoid too many people as adults. As we come back home, we introduce these germs to our home, so please wash your hands as soon as you enter your house. Wash things like your telephones, your screens, your tablets. Wipe them off with alcohol or disinfectant wipes periodically throughout the day. And have the children cover their coughs and colds with their tissue and wash their hands afterwards, or the inside of the elbow.
Thanks a lot, Dr. LaVille. The morning edition returns after the break.
Welcome to Sunshine Auto, your hottest place on the planet for rims, tints, tires, and auto sales. We are your auto superstore for rims, Lexani, Azaras, Trueform, Western, Lux, Fuel, Tracklight, Tough, Rough Racing, Velocity, Mud, All-Terrain, and low-profile tires. Cars, homes, and commercial window tinting. At Sunshine Auto, we put God first and customer is king. Blessed luck.
The Ministry of Health wishes to advise members of the public that prevention is key during this flu season. Practicing good cough hygiene can make the difference between you and your loved ones getting the flu or spreading the influenza virus. Good cough hygiene habits include covering your mouth and nose with a tissue when coughing or sneezing, and proper disposal of the tissue in a trash bin. Coughing or sneezing into your upper sleeve near your inner elbow and not your hands when a tissue is not available. Avoiding the use of handkerchiefs and towels as they hold germs, becoming a nest for the virus. And frequently washing your hands with soap and water, which is listed as one of the most important steps you can take to avoid getting sick and passing the virus on to others. If you have any questions about how to practice good cough hygiene to avoid catching or spreading the flu, contact your nearest community clinic or the Health Education Division at the Ministry of Health. This message is brought to you by the Ministry of Health in partnership with the Public Hospitals Authority.
I'm here at the Dixon Hill Lighthouse in San Salvador to let you know that marine protected areas make dollars and cents. A well-designed and managed network of protected areas can generate income for nearby communities. From MPA managers to lodges to eco-tours, there is money to be made.
Healthy marine ecosystems help to protect our islands from climate change and other impacts that we cannot control. Healthy coral reefs help to break down fake waves, and mangroves absorb storm surge and help to protect our coastline.
Older and larger fish tend to carry more and healthier eggs than younger fish. Fish replenishment areas will allow fish to grow bigger and ensure that we have more fish now and in the future.
In our replenishment area, fish are free to grow and reproduce. As their populations increase, more fish will spill over into other areas where fishermen can increase their catch and their income.
I support the establishment of a marine protected area on my island.
I support the establishment of marine protected areas on my island.
I support the establishment of marine protected areas on my island.
I support the establishment of a marine protected area on my island, and you should too.
And you should too.
And you should too.
And you should too.
See the future with Bahamas Protected.
Welcome back. Some businesses still focused on the bottom line, and this despite COVID-19. Our Crystal Darling speaks with a local business partnership about how they're promoting sanitation and encouraging shoppers to go cashless.
It takes a little bit of edging and a little bit of convincing, but people consider us trustworthy. So if we suggest something, they tend to try it at least once.
Cheesecake Heaven CEO Jameel Lightbourne says that he plans to keep his stores open. But with the concern of the coronavirus being transferred from person to person through money, the entrepreneur says that if customers feel uncomfortable using cash, he encourages them to use their cell phones for purchases on the Canoe app.
Right now, the government hasn't implemented a mandatory close for anyone. I have no kind of thoughts about actually closing my doors. A lot of persons would rather not use cash. Right now, we offer payment through the Canoe app, and we offer incentives like discounts and rewards.
And with public health concerns, CEO of Canoe, Keith Davies, says that the cashless system will lower the amount of contact for persons making financial transactions.
If you've ever handled cash for any period of time and you wash your hands, you can see the dirt in this. With the guidelines that the government has put out in terms of social distancing, and I think there's even been some mention of using less cash, we provide that alternative for individuals. We call it safe, easy, and cashless. So yes, we provide that avenue, and we will demonstrate and show individuals how they can use our platform to effectively follow those guidelines.
Davies says that business has been increasing for them, and he expects to see more users in the future. The service is also provided in various gas stations and food stores. The Canoe CEO says that as time goes on, the company wants to ensure that persons have the option to make safe cashless transactions.
The message to people is limit the instances where you have to interact. And this allows you to do that. At no point in time do you have to touch cash or touch a device to facilitate a transaction. Even so, when you have cash, you have to pull it out and you have to give it to someone. With the phone, you simply wave or wand the phone over the receiver, which is a Canoe device, and the transaction is made.
For the morning edition, Crystal Darling, ZNS Network News.
Well, mailboats connecting our family islands by delivering freight to those destinations. The captains of the Daybreak and the Lady Roslyn, Antonio Ema and Gifford Johnson, say while there's a steady flow, they're doing everything they can to protect themselves, customers and crew from COVID-19.
I guess it's the first week, so every time we go with a full boat. So the only thing I can tell them, keep down clean, keep washing their hands, and make sure they don't get mixed up with too much people.
We travel to each destination, North Eleuthera twice a week, and to Central and South Eleuthera twice a week. So it's 4 trips per week. Well, at present, it is business as usual. We're going into our various destinations. But precautionary in terms of the health side of it, we have our bathrooms, we have the hand sanitizers and the wipes. So for those of us who feel the need to consistently keep our hands and facial area clean, you have the opportunity to do so.
We also spoke to some customers about their fares and what packages they're sending over to relatives in the family islands.
The package is sappadilly. That was in the box. Sappadilly.
And you're not concerned about the corona?
No, I'm not. Not at this time. We only have a mailboat that goes twice a week. So I have my family in Harbour Island, and I'm sending their water and making sure their medication and everything is intact because I have little nieces and nephews. So that's why I'm here today shipping out their stuff.
Long lines, the order of the day at food stores this past weekend, with agitated shoppers getting a bit wary. One of them, Angela Daly.
I still think we are still too close with this virus. I think we're still too close. Another measure need to be done. I just don't think this one is working out. It's too long in the hot sun waiting to get in the food store, and same thing with Super Value. There's 2 shop I didn't do for the day, a long line.
Educator and customer Vandira Lundy also says she's incredibly dissatisfied with the arrangements by food stores because it's not adhering to the necessary health precautions.
This situation here at Solomon, it's an idea, right? But it doesn't make sense. Number one, because we're too clustered, we're not 3 to 6 feet apart, number one. And then people want some talking, exhaling and inhaling air. So I just pray God everything work out and someone come outside and trying to make the people stay apart 3 to 6 feet. This is too clustered. It ain't making no sense to me.
The COVID-19 stipulations also impacting funerals across the country. With that angle, we turn to a report now from our Catherine Gomez.
Prevention is better than cure.
As the government implements precautions to avoid the spread of COVID-19, it is truly a sad reality for the loved ones of the deceased. Families are grieving while also coming to terms with the new funeral regulations that only allow up to 10 persons to attend the funeral service. Daughter of the late Brenda Saunders, Indira Saunders, says though she knows this precaution is for the best, it's still hard to face.
These conditions aren't the easiest. They aren't the best conditions, especially with a family like ours where there are 5 kids and 6 grandkids. That's not to speak to my mother's siblings who would have flown in from other islands and other places to come and pay their last respects. It is a challenging time to be doing this, but we understand.
Indira also says she commends Sweden Colonial Mortuary for helping them through this process.
Even in social distancing at a funeral, that will be hard because we're all grieving and we will all be clinging to each other, all 10 of us. Luckily, through their professionalism, they have made arrangements for other family members to be able to be a part of our ceremony and to grieve, and that is necessary at this time.
Vice President of Sweden's Mortuary, Dominic Swain, says they are trying their best to help this family and others grieve while abiding by the COVID-19 precautions.
With our professionalism that we were actually trained with, we have to make everybody feel the comforts of losing a loved one. It's under these circumstances, she was a well-known lady, and a lot of people would have attended the service, but now there's only 10 people can actually attend the funeral service at this time. So, we understand. We understand how it is, and it is what it is.
Maria Rodriguez and her family are mourning the loss of her mother, and she says the coronavirus has really put a strain on her family's grieving.
It is a very difficult decision not to meet in a church setting to celebrate my mother. Our mother's homegoing. However, given the pandemic, globally, we have to respect and comply with the law.
Maria also says she advises Bahamians to wake up to this pandemic we are facing.
The only thing we can do right now is have faith in God and believe with the government for a solution to this pandemic.
As families try to mend their broken hearts as they cope with deaths, they are hoping the coronavirus will be eradicated so they can fully grieve their loved ones passing. Catherine Gomez, ZNS Network News.
You're with the Morning Edition. More after the break.
This public service announcement is brought to you by the Communications section of the Ministry of Education in conjunction with the Broadcasting Corporation of the Bahamas.
The Ministry of Education, in conjunction with the Ministry of Health, advises students, teachers, administrators, and staff to adhere to the following steps in an effort to minimize the risk of COVID-19, also known as the coronavirus. Step 1. Be sure to wash hands before and after you eat, after using the bathroom, touching money, shaking hands, or emptying the trash. You may also use hand sanitizers throughout the day. Frequently wash hands with soap and water for 20 seconds and rinse with clean water. Dry hands with clean paper towels. Step 2. Cough or sneeze into your elbow or sleeve and not into your hands or into the ear. Or cover your nose or mouth with a tissue. Immediately dispose of the tissue into the trash. Be sure to wash your hands thoroughly afterwards. Step 3. Do not drink from the same cans, bottles, or cups of other persons. Do not share eating utensils, such as forks and spoons. Do not share school supplies, such as pencils or pens. Step 4. Germs can live on many surfaces. Be sure to wipe and disinfect desks, school supplies, railings, and other surfaces that are regularly touched by others. Step 5. Avoid close contact with anyone who is coughing and sneezing. Let's do what we can to help minimize the risk of the coronavirus.
This public service announcement is brought to you by the Communications section of the Ministry of Education in conjunction with the Broadcasting Corporation of the Bahamas.
Andros is the #1 bone fishing destination on our planet. Sports fishermen visit our flats every year to participate in one of the most fulfilling outdoor activities known to man, fly fishing. And guess what? It's 100% sustainable. Without areas like the west side of Andros, sustaining this industry would be absolutely impossible. So let's take care of nature, and nature will take care of us.
As an artist, I travel all over the world, and I find inspiration all around me. In the people, and especially the environment. I love the Bahamas with all its natural beauty. From Abaco in the north to Inagua in the south, and all the wonderful and colorful islands in between. But we must all do our part to keep the Bahamas healthy and clean, now and for the future generations. That's why I want you to find a little time to do your part. I'm doing my part because I care. Do you?
We play just like your kids. We text just like your kids. We learn. We even cook. We take selfies. We have hobbies. And we love sports. In every way, we are just like everyone else and enjoy the same things and live our lives every day, just like you do. So if you happen to meet us, treat us just like everyone else. Because at the end of the day, we're just like you. Living life with Down syndrome is simply living. To learn more about Down syndrome, call 727-2105. This message is brought to you by the Grand Bahama Down Syndrome Society.
Good morning and welcome back to the Morning Edition. Thousands of children are home with parents for the next few weeks, but you can still get busy and practice social distancing. Joining us this morning and will be with us for the next 2 weeks is Downtown Natasha Brown. This morning she will be giving us some health tips on how to do those workouts at home, and each day you'll have a routine designed for a specific age group. But first, Tasha, tell us about safety and precautionary measures first.
Well, Charles, good morning. What I recommend is once you identify in your home, indoor or outdoor, and that is safe, there are a couple of things you'll be needing. You want to have a mat. You want to make sure that you have your sanitizing products so that you wipe down your areas, make sure it's safe, and that when you finish, you also want to do the same. You want to make sure you wash your hands, and you just want to make sure that you're just practicing what everybody else is trying to do to minimize coronavirus.
You talk about social distancing. If 3 of us want to exercise in the morning, how can we do that?
Well, you can. Just make sure that persons are anywhere between 3 to 6 feet, and also it depends on your routine. If you're going to have a very dynamic routine, you want to even make sure they are a little further, because sometimes when you're sweating and you're jumping and you're moving, sweat tends to jump and move as well. So there again, like I said, if you can have some of your stuff close by as you're working out, you can sanitize and make sure that your little area is safe and clean and ready to go.
Now you will be with us for the next few weeks. Each day you will be hitting a specific category.
Each day, and actually tomorrow morning, I want to make sure I get everybody that's going to be joining us. It's just going to be a general fitness. So the only thing you will be needing is a mat And every day I will let you know the next group so that you will be ready with your mat, or if anything else I decide, maybe that can enhance the routine, like a medicine ball or some dumbbells, I will indicate that at the end of the workout.
What are the specific age groups we will be gearing on?
Well, everybody is at home. Everyone is at home. And for those who are active, it's anywhere from for children 6 to 12, and even the athletes. The athletes will be getting a workout. So those persons, who were not able to do anything for the high school nationals, they will be engaged, so there will be a workout for them. And even our senior citizens, anywhere from 60 to 70, but I would say 85, because my oldest member is 85 and she's still working out. Yeah.
How long will these workouts last?
5 to 7 minutes for right now, for the ones that we will provide. But everyone else, if they can stick to their routine, which is 30 to 45 minutes, that's good.
Just because you're home stuck indoors does not mean you can't get out inside. Get inside and do those exercises. Once again, the downtown Natasha Brown will be with us starting tomorrow morning for those 5 to 6 minute workout. Who are we targeting tomorrow?
Tomorrow is general fitness. So the only thing you will need is basically your mat, a towel, your sanitizing products, something comfortable, and of course, an open mind.
You heard it here, so look forward to that tomorrow morning. I'll be joining here on the exercise, so it's going to be an interesting routine throughout the next 2 weeks. So stay tuned. Downtown Natasha Brown, she's in shape, I'm in shape, and we're ready to go.
Continues to monitor the coronavirus COVID-19. The COVID-19 pandemic wreaking havoc on lives and economies across the world.
So what should residents be doing right now?
Pay attention to the guidelines and the advice that's being put out by healthcare professionals.
What is preparation like for you before seeing someone who is presenting?
This crisis began in China, and that's significant.
China had their first case. That's when we started to prepare, because we knew it would be here soon.
The Ministry of Health is working to ensure the safety of the Bahamian people. Help us minimize the risk that coronavirus poses to citizens, residents, and visitors by following these 5 easy steps. Step 1. Wet your hands with clean water, apply soap and lather for 20 seconds by rubbing them together. Include the top of your hands between your fingers and under your fingernails. Rinse your hands under clean water, then dry them with a paper towel or air dry them. Remember to wash your hands before and after eating, preparing a meal, changing a diaper, or caring for the sick, and always after using the bathroom, touching money, shaking hands, or taking out the trash. Step 2. Cough and sneeze in your elbow or upper sleeve, not in your hands, not in the air. Or you can cover your nose and mouth with a tissue when you cough or sneeze. Put your used tissue in the trash bin when you're finished. Remember to wash your hands with soap and clean water after you cough or sneeze. Also, remember never to spit on the ground, roads, or in open spaces. Step 3. Ensure that raw meat is properly handled and cooked thoroughly. Step 4. Avoid sharing drinking glasses, eating utensils like spoons and forks, or sharing personal items such as toothbrushes and towels. Germs can live on surfaces we touch, so wipe and disinfect surfaces where germs can live, and keep your surroundings clean. Step 5. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing or sneezing. Should you or anyone you know feel that you have been exposed to the coronavirus, contact the surveillance unit of the Ministry of Health immediately. To reach us, call 502-4776, 502-4790, or 502-4737. We want Bahamians and those that live with and visit us to remain safe from the coronavirus. To do this, we need the help of each and every one of you to follow the simple steps we have shared. Let's stay safe, Bahamas.
Well, we'll now take you to our Lloyd Allen for your daily traffic commute. Good morning, Lloyd.
The traffic report is sponsored by Bahamas First. First in insurance. Today, tomorrow.
Yes, Makushla, what you're looking at is a drone shot right above Doctors Hospital. Good morning to all of our viewers. This morning, our initial traffic report coming in from the area of Shirley Street and Collins Avenue. And of course, traffic is significantly reduced as we know that many school runs are cut off until about April 14th. And a few persons heading out to work, others making their way to their various destinations. The advice given to motorists this morning is to drive with caution and with care. This morning, I'm also joined by Sergeant Devon Frazier from the Royal Bahamas Police Force Traffic Division, who's giving us an initial look at weekend traffic. Good morning, Officer Frazier.
Morning to you, morning Bahamas. Over the past weekend, the 72-hour period, we had a total of 37 accidents, 19 being accidents with damages only, 10 of which are accidents with minor injuries, and also 8 hit-and-run accidents, which is a no-no. I just want the public to know we have bolos circulated for those vehicles. If you know you were involved in a hit-and-run accident, please come into the traffic police station and seek so we can sort the matter.
Now, of course, we know this was the first weekend over the last few days. Many persons are confined to that curfew, 9 p.m. to 5 a.m. Any incidents, any arrests over the weekend?
Well, I wish not to comment on the total incidents, but we did have some arrests and persons were taken into custody where they will be dealt with. I just want you to remember the fine is hefty. The fine is hefty for being out on the streets if it's not important.
So that's $10,000 or 18 months imprisonment or both. Now, of course, persons may be on the road during that time for various reasons. Hopefully an emergency. Any advice to motorists if an emergency happens during the curfew?
Well, if you have to be on the streets past curfew, we have a hotline. The number is 311. You can call that number, seek clearance, and you'll be guided as to what you have to be on the streets.
All right, some great information there. Of course, as we said, traffic is significantly reduced in this area as many persons off the streets away from work. Those school runs not continuing at least up until about April 14th. Reporting from Shirley Street this morning, Lloyd Allen for Morning Edition. Makushla, back to you in studio.
Well, thanks, Lloyd. When we return, a check on whether you're watching the Morning Edition. Stay with us.
Continues to monitor the coronavirus COVID-19. The COVID-19 pandemic wreaking havoc on lives and economies across the world.
So what should residents be doing right now?
Pay attention to the guidelines and the advice that's being put out by healthcare professionals.
What is preparation like for you before seeing someone who is presenting?
This crisis began in China, and that's significant. China had their first case. That's when we started to prepare because we knew it would be here soon.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
This message has been brought to you by the World Health Organization, Pan American Health Organization, Ministry of Health, and the Broadcasting Corporation of the Bahamas.
Well, it's time for our morning forecast, and we are under partly cloudy skies with a temperature of 73 degrees. The relative humidity is 77%. We have southeast winds at 5 miles per hour. The barometric pressure 1,023.1 millibars. That's 30.22 inches, and your pressure is steady. Temperatures around the islands this morning: Marsh Harbour at 74 degrees, 70 degrees in Greentoll Key, Freeport at 70 degrees, the Berry Island 75, Alistown, Bimini 76 degrees, 73 in Harbour Island, Roxanne in Lutra 75, Artistown, Cat Island at 73 degrees, 75 in Staniel Key, Kemp's Bay, St. Andrews at 75, Fresh Creek, Central Andrews at 73 degrees. In San Salvador, 73. Also in Rum Key, they have 73 degrees. Ragged Island, 74, Clarence Sound, Long Island, and Crooked Island, all reporting 74 degrees. 76 in Betsy Bay, Maguana, Acklands at 76, Matchetown, Inagua, another 76, and also our neighbors to the southeast, the Turks and Caicos Islands, they're reporting 76 degrees this morning. And our boating forecasts are for today in the northwest and central islands. The winds will blow out of the southeast at 10 to 15 knots. Your wave heights 2 to 4 feet. High tide 8:14 this morning. The low tide will take place at 2:31 this afternoon. In the central and southeastern islands, well, really for the southeast Bahamas, the winds will be easterly at 12 to 18 knots. The wave fights 3 to 6 feet over the ocean. So we'll keep that caution flag in place just for today for the southeast Bahamas. And now for your satellite picture, it is showing some patchy clouds being advected from the east towards the west. So there will be occasional pockets of cloudiness moving across the islands today, but in between we will have quite a bit of sunshine. Rain-wise, relatively dry, may get 1 or 2 brief passing showers as we go to our forecast breakdown. Partly sunny and warm today, 82 degrees for your high temperature, and tonight we're looking at near clear skies because most of those clouds should move off towards the west. And your low temperature getting down to a very comfortable 68 degrees. Your extended weather forecast, well, those 80s have not changed. Low 80s, that is, right through the 7-day cycle. Your nighttime temperature is pretty stable at 70 degrees. And we have an abundance of forecasts taking us into the balance of next week and right into the weekend. Makushla?
That does it for our news this morning. Once again, I'm Makushla Pinder. Before leaving, we invite you to join us for a national address by the Prime Minister on COVID-19 this evening at 7 on the ZMS Radio and Television Network. Enjoy, everyone.
Bahama Rock, everybody's out there on the dock. They're doing what we call Bahama Rock. Hey, hey, hey.